Hello and welcome to Team 6 Applied Project, Phases 1 through 3. Today we'll be discussing Adventist Healthcare, specifically rural healthcare clinics. Team 6 consists of Leanne Goodwin, Alfonso Powers, Nicholas Sinden, and Casey Stoller. The rural healthcare and hospitalization industry is relatively new but is up and coming in terms of share in the overall healthcare industry, which has experienced significant growth within the past 20 years. As more people move out to rural areas to get away from a busy, bustling city life, coupled with the aid of modern technology to add efficiencies for both organizations and the individual, healthcare for this segment of the population is growing in need and popularity. Some key points to highlight about the current state of the industry are that 1. It is heavily regulated. A good example of this is the Affordable Care Act of 2011. In addition to efforts to pass further legislation that many candidates of the upcoming presidential election are focusing on as part of their campaign plans. 2. The industry has experienced recent significant growth from about 500 players in the 90s to now over 4,000 in 2015. 3. Two primary sources of revenue come from Medicare and Medicaid, and thus they are very reliant on those sources of funding. A big part of this comes from the Rural Health Care Act of 1977. 4. As with healthcare industry as a whole, the rural health industry experiences very high fixed and sunken costs, which has really hindered many opportunities for growth in the past. 5. Due to many factors, including dealing with heavy regulation and high fixed costs, the industry has been notoriously slow adopter of modern technology, which further impedes growth efforts, negatively impacting these organizations' ability to reach further segments of the population. Despite its historical shortcomings, the industry is beginning to experience tremendous growth and becoming increasingly progressive in terms of seizing opportunities to provide both greater access and value to the customer experience. Let's take a high-level look at the 5 industry forces affecting rural healthcare and hospitalization. Barriers to entry facing new contenders are large upfront costs and infrastructure, strict regulatory requirements to maintain, and difficulty in recruitment efforts of qualified physicians. Bargaining power of buyers is very low in this industry. This is primarily because in rural healthcare, consumers don't typically have a lot of choices of where they can seek care due to geographical perspective. Another issue that affects bargaining power is the limitations imposed on consumers by pharmaceutical and insurance company in terms of in-network restrictions on what they are or are not willing to cover. On the other hand, bargaining power of suppliers is on the rise, as there are not a lot of companies that supply to rural healthcare organizations, and these hospitals and clinics are dependent upon the suppliers to provide them with the supplies they need to continue to operate, making them very important players in the industry. The threat of substitutes facing rural healthcare market is generally very low, and the only real, although minor threats are the inactions of consumers to maintain good health, preventative measures to ensure good and prolonged health, and alternative medicines such as holistic health-focused options and organizations. Finally, this all ultimately centers around health of the industry and thus the level of rivalry occurring within. Rivalry in the rural healthcare and hospitalization industry is very low. When consumers are faced with an option, however, the organization to realize a competitive advantage are those that give consumers the best price, convenience, and the quality of care that they feel is valuable. Adventist Health is a nonprofit organization founded in 1980 from the Seventh-day Adventist Church, creating a centralized management of hospitals that now spans more than 275 rural and hospital-based clinics. Headquartered in Roseville, California, the company has seen substantial growth over the past few years, with a 12% increase in patient visits during 2014. The healthcare industry is very competitive, and Adventist Health has several mainstream competitors, including Community Health Systems, Dignity Health, and St. Joseph Health Systems, all of which operate urban-based hospital and health clinics. Adventist Health has a strong Western region presence in California, Oregon, Washington State, and Hawaii. Our business model canvas shows us that Adventist Health relies on key partners to maintain a large market presence against the competition. Strategic partnerships, personnel relationships, and both the state and federal governments play instrumental roles in assisting Adventist Health to deliver quality health care. The key activities offered by Adventist Health aim to deliver high-quality health care through integrated health delivery systems and a continued effort to develop technology platforms in medical services. Like many organizations, Adventist Health relies on key resources to deliver quality care, from real estate locations in key geographical locations, intellectual property branding, personnel, and financial resources. All aspects play important roles in an organization's ability to offer quality medical services. High-quality healthcare services and efficient processes are primary value proposition to patients to help reduce healthcare costs and maintain unique customer relationships on a personal level, but also to allow the customer to maintain the freedom of self-service capabilities to manage their own care. The customer base is segmented into three primary payer types, including private payers, Medicaid and Medicare, and insurance companies. The healthcare industry is expensive, and Adventist Health operates on a fixed or sunken cost structure, but is looking to expand strategic partnerships to eliminate or reduce costs substantially. Medicaid and Medicare are a primary revenue stream to aid Adventist Health, but employees and employers also contribute to the revenue stream through healthcare premiums and tax collection. The strengths, weaknesses, opportunities, and threats analysis indicates that Adventist Health is in a strong market that has shown a significant increase in demand over the past few years. With the adoption of the ACA, there is a higher demand for quality healthcare services due to the increased number of patients seeking care. Particularly, Adventist Health shows significant strength in presence by maintaining a large market share over competitors through strong strategic partnerships and cutting-edge technology. The analysis did show that certain lines of service offerings present a challenge for Adventist Health to deliver, specifically post-acute care, ambulatory, and wellness programs. And of course, the industry is saturated with heavy fixed costs. These identified weaknesses present opportunities that, if acted upon, Adventist Health can expand its already large market share presence. To achieve this, continued development of technology and forming strategic alliances will play a critical role to continuing the organization's success at offering high-quality healthcare. Finally, healthcare organizations are not immune from threats to their survival. Stricter legislation and regulatory compliance requirements continue to make the industry more difficult to operate in. As the industry expands, larger organizations have a better chance at survival because of the abundant resources that can be tapped into to better cope with industry change. Currently, all health consultations are conducted in person. The first visit would be primary physician who will complete the patient consultation. The primary physician will determine what follow-up care, if any, is required. If a specialist is needed, the patient will schedule an appointment with the specialist as part of the follow-up care plan of primary physician. This requires the patient to travel at a later date in person to visit the specialist. Additionally, the patient completes other follow-up care instructions at home, such as medications to be taken for a certain period of time. Once the patient has completed the follow-up care, they may or may not need to have another visit. If a condition is completely resolved, there would be no follow-up. If a condition is not resolved, there would be a follow-up care with whichever physician they saw last. It is important to note that the patient cannot see a specialist without first going to a primary physician. Also, the patient has to travel, often for long distances, to each separate appointment. While the as-is workflow does achieve the overall goal of the patient treatment, it is lacking optimization. A major challenge for patients is the long distance traveled in order to receive care. The challenge with rural health clinics is that most patients are from low-income households. Because the cost of care and the distance create hardships for patients, there is a high rate of no-shows or canceled visits. When patients do arrive, they have to go through their primary care physician to be referred to a specialist. Given the rural location, there is often a lack of options for specialists in a specific geographical region. All of these challenges add on time and cost to treatment. In the proposed to be process, the patient schedules the appointment with their primary care physician, who is a general practitioner. Before the patient consultation, the primary physician directly contracts a specialist. The patient arrives at the rural health clinic to see their primary physician, who will consult via teleconference with the specialist. The two care providers together create a plan for patient care. The patient will only schedule one appointment in order to see the specialist. After the appointment, the patient returns home and completes any follow-up home care. If the additional visits are needed, the patient again contacts the primary care physician to schedule the next appointment with a specialist physician until the condition is resolved. By revising the workflow, the patient experience greatly improves as they benefit from a more specialized and convenient ongoing medical support. The new to-be process greatly expands the network of specialists that the patient has access to, and previously that many had to pay out of pocket to see, making it more likely that the patient will return to Adventist Health for future visits. It will also make the patients more likely to attend rural health clinics and not cancel as the care being received is greatly improved. While it is important to have happy and healthy patients, this in turn is also beneficial to Adventist Health. The improved customer experiences in itself will grow more loyal patient base as the new platform opens up and potentially for entirely new types of revenue streams, which will ultimately increase overall revenue. By altering the process for patient visits, Adventist Health is moving ahead in the industry and answering the needs of rural life. We've committed to being a leader in technology as an organization and as well as a leader in the healthcare industry. We have incredible opportunity to further leverage technology directly into the patient care. Finally, society is incredibly globalized and healthcare labor costs are very high. Through this platform, we can gain more geographical flexibility on staffing positions. Specialists that previously were not interested in working in the specific location can now consult from urban areas. Overall, the new process lowers costs by eliminating the need to employ specialists in rural areas and simultaneously increases revenue by seeing more patients. An important measurement technique to determine overall project success is the balanced scorecard. There are four major components to consider. First, let's review the predicted financial impact. Per calculations, a 7% projected increase in revenue is predicted. This can be measured monthly through regular financial reporting. Also, another major goal is to improve customer experience, targeting 9% as calculated through customer surveys. Customer surveys can be automated through the patient portal. The learning goal is to expand educational resources, which will also be supported through the patient portal. The specific goal is that 99% of patients will be providing reference materials to their condition through a portal. Finally, the last goal is to optimize team utilization, with the goal being 98% of target. The next steps for this project are as follows. Planning and design for 6 months, development for 6 months, Q&A and testing currently scheduled for 10 months, and go live scheduled for 2 months. In total, the project is predicted to take 18 months. The real next step for this week, though, is to get the board's formal approval to authorize this project, giving it strategic importance in driving innovative processes and creating both short and long-term financial value through increasing revenue and controlling costs.